And hello there, it's noon on this wet Friday, and we're supposed to have a cold front. I haven't been outside, so I don't know if it's come through, but it was kind of hot and steamy yesterday, so I'm looking forward to the cooler weather. Today is our regular Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness, which is our holistic healthcare clinic located in downtown Humble at Main Street and Avenue C. So thank you for making time to join me in this busy day. And I think it's going to be kind of a fun program because when I was looking around trying to see what was going on out there in the big world, I know that we are being bombarded with get your flu shot, get your this shot, get your the other shot. And so I had posted yesterday, I don't know if you saw, but I had posted Suzanne Humphreys, Dr. Suzanne Humphreys. I think I'm saying her name correctly. I have so many different specialists in my head, but I think that's the video I posted. And she said that if you get the flu shot, you are more susceptible to the flu in subsequent years. So we don't believe in flu shots. I'm just going to throw that out there. I've never had a flu shot. I've never had the flu. The only thing that a flu shot will do is it will lessen the severity of the flu by 1 day. It will not prevent you from getting the flu. The only thing that prevents you from getting the flu is to have a good, strong immune system. So when the flu bug comes in your passageways, that your body rises to the challenge and takes care of it before it gets you. So that's our stance. We do have homeoprophylactic flu protocols here. So if that's something that you want to look at, then we'll be happy to help you with that. We used to have a pill that you could take and it was as effective as the flu shot, but somehow some of the ingredients are no longer available. They cannot find reputable sourcing, so they're trying to reformulate that. So we've got that available for you should you feel like you want to take advantage of that. So I'm going to talk about viruses. There's some good benefits to having a virus, and so we're going to talk about that. I know it's like heresy to your ears and you don't even want to hear this because everything in mainstream media and marketing is viruses are bad. Be vaccinated so you don't get these viruses. So this is, I don't even know if I have where I found this. So it says it's true that most viruses have a pathogenic relationship with their host, meaning they cause diseases ranging from the mild cold to serious conditions such as acute respiratory syndrome, which is SARS. We know that SARS was all around recently, few years back. They work by invading the host cells, taking over the cellular machinery and releasing new viral particles that then go on to infect more cells and cause illness. Now, this is really important that you understand this because if you have a strong immune system, as soon as that virus particle gets in and starts hijacking your immune system is going to recognize it. Your immune system is going to send its natural killer cells and all that kind of thing to take care of you. And so you're going to be able to stop the invasion before you get sick. Now, this is what most people don't understand. You have a virus in several days before you actually have a symptom. That's called the incubation period. If you have a working immune system, the immune system is going to attack that virus during the incubation period so that it does not what? Incubate. It does not produce more. So, true story, this is me. A few years back, it was Thanksgiving, and my son was working. He was working in a service job. He was at a restaurant, very nice restaurant. And it was Thanksgiving Day, maybe the day before Thanksgiving, and he said, I'm not going to work, I don't feel well, and he was all snotty and all kinds of things. He did come over, we did have a nice Thanksgiving, and then when he kissed me on the way out, this is what we do, this is my family, we kiss each other, and he kissed me on the mouth. And when he kissed me, I swear to God, as my witness, I felt the germ, and I thought, oh, I'm probably gonna get sick. And I didn't say it out loud. I just thought that in my little heart. The next morning, the day after Thanksgiving, I woke up and I did not feel good. And I said, I knew it. I knew it. Now, I wasn't sick. I just felt off. So what did I do? I came into the clinic and I probably went into my pantry because I have these things at home. I got IVH, which stands for infection and virus. and I got wild oregano oil, which is in a little caplet. It's a little jade colored gel cap. Wild oregano oil, not your essential oil. It's a different oil. It is a natural antiviral. And I set my cell phone for every 2 hours. And every 2 hours, I took a dose of both. And by the end of the day, I was feeling myself. I never came down with any symptom. I never had any problem. Why is that? That is because I am in tune with my body. So when I feel off, okay, I know something is incubating and I take care of the incubation process. I interrupt the incubation process so that I don't ever get sick. Now, I have not been sick. I cannot tell you when the last time I was sick. I mean, I just can't tell you. There are no medical records and I've not missed a day of work. And so I'm just telling you, if you do it right, it works. All right. They're not all bad viruses. Some viruses can actually kill bacteria while others fight against more dangerous virus. So like a protective bacteria, a probiotic, we have several protective viruses in the body. So bacteriophages are, or they shorten it to just phages, P-H-A-G-E-S, you might say phages, are viruses that infect and destroy specific bacteria. They're found in the mucous membrane lining of the digestive, respiratory, and reproductive tracts. So, just a sidebar here. If you have leaky gut syndrome, then the mucosal lining of your intestinal tract is not intact, so you probably don't have these phages in there that are doing their job. Mucus is a thick, jelly-like material that provides a barrier, a physical barrier against invading bacteria. It protects the underlying cells from being infected. Recent research suggests that phages present in the mucosa are part of our natural immune system, protecting the human body from invading bacteria. So, did you know that you could have a virus and it could be a good thing? Well, it was news to me too. I mean, I know we have viruses. We have people that come in all the time and I'm testing them for viral loads. And even though they have no symptoms, they do have the active viral particle in the body. It's just not giving them any trouble right now. All right. Phages have actually been used to treat dysentery, sepsis caused by the staph bacteria, salmonella infections, and skin infections for nearly a century. Early sources of phages for therapy include, you're not going to like this, local bodies of water, dirt, air, sewage, and even bodily fluids from infected patients. The viruses were isolated from the sources, purified, and then used for treatment. I'm just going to tell you, they don't do that now. They don't take it from your dirty water or your infected people. They actually genetically modify these viruses and they can put them in your system. It can be part of your protocol. If you're one of the people that needs that, then you can go to the doctor. And like I say, they will genetically modify the viruses. They will build them in the lab so that you can have that therapy if that's what your choice is, okay? Phages have attracted renewed interest as we continue to see the rise of drug-resistant infections, okay? Recently, a teenager in the UK was reportedly close to death when phages were successfully used to treat a serious infection that had been resistant to antibiotics. And I went and I looked at this story, and they did do genetically modified viruses. They injected this young child, and the child recovers. He was very, very near death. Somebody else in the neighborhood had died of the same kind of whatever it was, and they were able to get this genetically modified virus into this child, and it took care of the bacteria. Now, it goes on to say that they're genetically engineered. Individual strains of phages are tested against target bacteria, and the most effective strains are purified into a potent concentration. So at the thing in England, they had to isolate the bacteria and then they had to run it through a series of tests to see which of the phages were the right one. Then they genetically engineered a cocktail, and that's what helped this little boy get well. I thought it was very, very fascinating. Now, I'm just going to tell you, MRSA is a real thing here in the United States. It is antibiotic resistant bacteria. And you have to have really, really, really strong antibiotics to kill it. So thank God we've got those antibiotics. But there are other things that you can do as well, and we do those here in the clinic, and I'm going to talk about that in a minute, so don't let me forget. If I start to forget, somebody remind me, okay? So beneficial viral infections. Viral infections at a young age are important to ensure the proper development of our immune system. In addition, the immune system is continually stimulated by systemic viruses at low levels sufficient to develop resistance to other infections. So this is what you need to know. When we have our children and our children are getting these viruses, measles, mumps, chickenpox, all that, that shows the immune system what to do. So when we get old and we get cancer or whatever, your immune system is strong and your immune system knows where the invaders are. When we constantly suppress the immune system with vaccines, then the immune system never develops and it doesn't understand what a true pathogen is. I think, it's been a long time since I researched this, but I've got podcasts and all that kind of stuff. I think the measles virus protects a woman from cervical cancer. I think that's right. You're going to have to check me on that. But a measles virus is very, very good for women, some reproductive cancer. Childhood viruses do not normally pose any detriment to the child. I mean, I remember having these viruses as a child, and I laid up in the bed. My mom gave me ice cream. I mean, that was the worst thing that ever happened. And I have lifelong immunity to those viruses because I had those viruses. And so the viruses stimulate the immune system to become stronger. And this is what we know. It says, for example, the latent non-symptomatic herpes virus, and I know none of us want the herpes virus, okay? And I'm not talking necessarily about the sexually transmitted herpes virus, but chickenpox is a herpes virus. Shingles is a herpes virus. Your common everyday cold sore is a herpes virus, okay? It's all part of the same family, just a little bit of a different tweak in the gene that makes up that virus. So a latent non-symptomatic herpes virus can help human natural killer cells. These are a specific type of white blood cells identify cancer and cells infected with other pathogenic viruses. They arm the natural killer cells with antigens, a foreign substance, so that the immune system can recognize it in the body, and that will enable them to identify and to kill the tumor cells. So this is nobody ever wants to have a virus, okay? I get that. But this is a latent virus, a virus that is not manifesting. It actually causes your immune system to be stronger and have more natural killer cells. So if unfortunately you do have the opportunity to have cancer, your immune system is at the ready and it probably will take care of it before it is diagnosed. You know, maybe you don't know that you have cancer for 10 years before you have a tumor large enough to be detected on any medical test. So just going to throw that out there. So we can protect ourselves from today going forward if we just make some kind of changes in our diet and the way we live, okay? Going back to the latent virus, it says this is both a survival tactic by the virus to last longer within the host and to get rid of competitive viruses to prevent them from damaging the host. In the future, modified versions of virus like these could potentially be used to target cancer cells. I do know, because I have holistic clinic friends who are they're medical doctors that have gone holistic and they treat cancer in a holistic way. I do know that they do use the MMR virus as a vehicle, an envelope, in order to push cancer therapies into the patient. So right now, even though it's not necessarily mainstream, scientists are using viruses in order to help with targeted cancer treatment, okay? So there's another virus. It's called the Peggy virus C. It's is a virus that does not cause any clinical symptoms. Multiple studies have shown that HIV patients infected with this virus live much longer in comparison to patients without it. The virus slows down the progression of the HIV by blocking the host receptor cells required for the virus to enter into the cell and release the virus, detecting interferons and the cytokines. All of those are just the proteins that the virus produces. Okay, so this virus, if you have this virus, and this is a protocol at your doctor that they will inject you with this virus because this virus slows down the progression of the HIV, which I think is just an awesome thing. Okay, so we know that as we move forward, the scientists are going to continue to do genetically modifying viral strains in order that they would be able to help us. Just going back to my original statement, if the children have the natural childhood diseases, then they're going to be just fine. So now I want to segue over to honey, because honey and viruses have something in common, which I thought was very ironic, okay? So honey is what bees make. I think everybody knows that. There is raw honey, which is honey from the hive that has passed through a sieve. The sieve weeds out the honeycomb and also the dead bees. Now, when I was researching this, I thought, well, I never ever thought that there would be dead bees in the honey, but apparently there are dead bees in the honey. So that is what raw honey is. It's honey from the hive. It's just been filtered through a sieve to remove honeycomb and bee particles. The local honey, or maybe not local honey, but what you buy in the grocery store is pasteurized. It's heated to a very high temperature, it's pasteurized, and then it is filtered, and they remove a lot more components than just the dead bees and the honeycomb. So we're not wanting you to do a honey product. We're wanting you to get a honey that says local honey, that you know the beekeeper and you know that all he has done, he's just filtered it through a sieve to remove the protein and the honeycomb. In fact, I've even seen some local honeys that have the honeycomb in there to prove that it's local honey. I'm not necessarily fond of a honeycomb necessarily in my honey, but anyway, we get the local honey. We know the guy, and he doesn't heat treat the honey, and that's the difference. So raw honey has a lot of healing benefits, so we want to talk about that. It feeds good bacteria, okay? There's a little known fact that bees, the actual bee, has a diverse population of beneficial lactic acid bacteria in their honey crop. This is the bulge between the esophagus and the gizzard of the bee. According to newly published research, studies of the LAB, now remember that's lactic acid bacteria, in all honeybee species, plus related apis bees, reveal one of the largest collections of a novel species from the genre Lactobacillus and Bifidobacterium ever discovered within a single insect, okay? Suggesting a long history of association. So when the bees make their honey, it goes through the honey crop, and so it gets infused with all of this good bacteria. So that's a good thing, okay? It fights the bad bacteria. So reports of honey eradicating MRSA infections have been reported in medical literature for well over a decade. And so we talked about the virus, that latent virus that would take care of the MRSA. Honey also will take care of the MRSA. It has to be raw honey. Someone's asking about Manuka honey. Manuka honey is more of a brand. If it says Manuka raw honey, then you're good. If it doesn't say raw, then I'd be a little bit suspicious of it. So you might want to look at that. Anyway, we have known, and I have even seen in the pharmacy now, they've got patches infused for a wound. They've got like Band-Aids, patches that are infused with silver And we also have patches that are infused with honey. So the mainstream medical profession is coming online, and they're knowing that raw honey is beneficial, and elemental silver also is very elemental for wound healing. So the Manuka honey, or not Manuka honey, sorry, you got me off track here, Marianne. Let's see, the honey, okay. MRSA, which is an acronym for methicillin-resistant Staphylococcus aureus, produces a biofilm that makes it especially resistant to conventional antimicrobial agents. Honey is shown to be effective at killing the biofilm-associated MRSA isolates from patients suffering with chronic rhinosinusitis. It's also been demonstrated in human research that a 70% effective rate in destroying MRSA in chronic venous ulcers. Okay? Moreover, this honey synergizes with conventional antibiotics, making MRSA bacterial isolates more susceptible to their antibiotic action. I've also seen people here in the clinic who had a wound that would not heal, and they took that raw honey and they just put it on the wound, and sure enough, that wound healed. So honey is a good thing to have in the house for wound healing, okay? It kills, and I love this, and I'm going to try this. It kills dental plaque causing bacteria. Okay, so honey, right, produced from the flowers of the Manuka plant. I guess that's where the Manuka honey comes from. So the flowers of the Manuka plant that grow in New Zealand and Australia have shown to be at least as effective as the chemical chlorhexidine gluconate, often used in mouthwash, in reducing plaque formation in the mouth. Okay, so what this means is if you swish with your chemical mouthwash and then you swish with honey, you're going to have exactly the same amount of plaque reduction, which I thought that was just amazing. I'd rather definitely do a spoonful of honey, right? Raw honey, and make sure that that takes care of dental plaque issues. It's not something that I'm really prone to, but if that's something that you're really prone to, then you can just have this raw honey and see where you are. Okay, honey is superior, raw honey is superior to pharmaceuticals at killing herpes. Now, I think this is really, really interesting. And you see how I was reading about herpes in the virus article, and now I'm reading about herpes in the honey article. So honey, raw honey, is more effective with herpes lesions, both on the lips and in the genital area. So never thought of putting honey on the hoo-ha, but then again, I don't have genital herpes, so I guess that's a good thing. But if that pertains to you, or if it pertains to somebody that you know, you can do raw honey on the lesions, and it is more effective than your pharmaceutical. So this was a study in the Medical Science Monitor, showed that topical honey was far superior to the drug acyclovir, I think I said that right, which trade name is Zorvirax, Zorvirax, I think, in treating both labial, lip, and genital herpes lesions. According to this amazing study, okay, for labial herpes, the mean duration of attacks and pains, occurrence with crusting, and mean healing time with the honey treatment were up to 43% better than with the aclavar drug. Okay, for genital herpes, right, it was up to 60% faster healing than the drugs. Okay, that's just crazy. Honey is better than the pharmaceutical. I don't know how much those pharmaceuticals cost these days, but I know what honey costs, and almost everybody can afford that. All right. With the honey, okay, 2 of the cases, they did this on how many cases? Let me see. I think they did it on 6 cases. For 2 of the cases, the labial herpes and 1 case of genital herpes remitted completely just by using the honey. None of the patients remitted completely with the drug. So I think that's just a really, really good thing about the honey. No side effects were observed with repeated applications of honey, whereas 3 patients developed local itching with the drug. So I'm not sure how you would necessarily not ruin your panties if you did this, but if it's going to get rid of those lesions and it's going to get rid of them in 60% faster time, I think I'd be doing that. Just going to throw that out there. So the final thing I want to talk to you about, and you're going to laugh because I'm going to show you my scratching on here. It's protective against gastric damage. So what is gastric damage? Gastric damage is an ulcer. Gastric damage is leaky gut syndrome. Gastric damage is when you have food sensitivity. So that might be something that pertains to you. So honey has been shown to prevent alcohol, ibuprofen, and aspirin-induced lesions. So these are ulcers in the stomach, okay? This is just a sampling of the research indicating the profound medicinal value of honey, okay? If you would like to view the full, there's give you a website here, which I can definitely put on the bottom of this post. I read this about gastric damage because we have a lot of people that come in. And so here's my little, see all my math there? And I am not a math person. I'm just going to tell you, I'm not a math person. But the amount of honey that you need to have, because I wanted to know how much honey do you need to consume in order to repair your GI tract, right? So it is 2.5 grams of honey per kilogram of body weight. Okay, so that's what all my hen scratching is, because I had to convert grams to ounces, and then I had to convert ounces to teaspoons, and then I had to convert my weight to kilograms, and then I had to do all the math. Essentially, for me, I would need 3/4 of a cup of honey every day, which I guess that's a lot of honey when you think about it. But you know, they did this experiment on rats. So maybe doing it on humans is a little bit different with the body mass size and all that kind of stuff. I mean, I'm sure my stomach is not that much bigger than a rat's. I mean, a rat is small and I'm big, but I'm just saying the rat's body compared to my body, the rat's stomach compared to my stomach. So probably would need to refine this. But even so, if I had gastric issues, I could probably... So, honey is good for you. Make sure that you buy from your local beekeeper. If you don't have one, you can buy it from me because I have a local beekeeper, okay? Honey is also good for allergies, but only if it is local honey, because it'll have the same pollen in it that you're allergic to. And also, don't be afraid of viruses. Now, I'm not saying go out and just get contaminated. That's not what I'm saying. What I'm saying is keep your immune system strong so that when a virus comes into your vicinity, your immune system knows what to do. If your immune system is weak and you wake up and you feel bad, then I've got different herbs and supplements that you can have in your pantry so that you never ever have to have a problem. I was cleaning my face, as I always do before I go to bed, one night last week, and when I was putting on my face cream, I happened to come down my neck. And when I touched that lymph node right there, it was like a marble. It was a hard marble, and it was a little bit painful. And I thought, oh, I'm incubating something. And I went down into the pantry, and I took 2 wild oregano oil, which is a lot. And I woke up the next day, and the marble was gone. So you can stop the incubation very, very quickly if you have what you need to have on hand. So that's my tip of the day. It is Friday, so I want you to take care of yourself over the weekend. Have a great weekend. I think we're like camping or something this weekend, so I hope the weather holds out. You guys take care. I will see you next week.